everyone. I wanted to start today with a song, as I would in a music therapy session with most of my clients. Everyone's here and it's time to say hello. Everyone's here and it's time to say hello. Hello, hello, hello. Everyone's here and it's time to say hello. Everyone's here and it's time to say hello. Hello, hello, hello. Hi everyone, my name is Anurati Jain, and thank you, Jim, for introducing me to everyone. What I just played was a hello song that I would do with a lot of my clients at the beginning of our session. Although hello songs are kind of, they have to be age appropriate, so some clients may prefer them, some clients may not. A lot of younger clients prefer them, or clients with lower cognitive abilities may prefer them. But I just use it to the client's discretion. Well, a little about myself. I'm a board certified music therapist. I work here in Indianapolis, Indiana, and I've been working at Insights Consulting for almost 2 years now. I work with people with mostly developmental disabilities. So, what is music therapy? I took this mainly from the American Music Therapy Association. So, it is an established health profession, and it is used to address physical, emotional, cognitive, and social needs of individuals. And a qualified music therapist provides treatment by creating, singing, moving to, and or listening music. And eventually those abilities are transferred to other areas of the client's lives. So usually we use preferred music. I have to learn the music of whatever my client would like me to use, to listen to during the sessions. It can be anywhere from hard rock metal to very slow, soft music, or it can be music in different languages that I might have to learn. Most of the time, I try to use live music, but sometimes I may also use recordings, whatever the clients prefer again. So the interventions or experiences for music therapy are specifically crafted to adhere to their individual needs, and goals and objectives are all individualized. They're all based on the client's needs, and they're all addressed and worked on so they can eventually be generalized into their everyday life. So how does music work? So there's a lot of evidence out there that listening to music, playing music connects all the different neurotransmitters in your brain. So music therapy is highly effective, and the music and the rhythm influence that connectivity in the different parts of the brain. So even the parts that you may look at a person and you may think like, oh, I'm not sure, if they're able to use these words to communicate, or if they're able to use this part of their brain, even those parts might be activated while listening to and participating in playing music. So I wanted to show some videos related to this, related to how music works on the brain. So this is neurologic music therapy. It's something you can get trained in, something you can get certified in. But I did get certified in this before, but I don't think I'm going to do that again. I like to usually take these techniques and incorporate them in my regular music therapy. sessions. So this is called rhythmic auditory stimulation.
Smiling. I'm almost done. Okay?
Yeah, almost here, without a pain.
And there's one more technique I wanted to show you. This is also part of neurologic music therapy. This was called melodic intonation therapy. So that one was more to do with gait, which used more often with individuals who might have experienced stroke or Parkinson's disease. So similar to that, this is working on speech and communication.
What? Yeah, what? What? Hello, 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 hello. I am juice. I am juice. What's your name? I am used.
So that was a little bit of how music therapy works with the brain. So a little bit about the education and training. I went to a 4-year undergraduate program to obtain a bachelor's degree in music therapy at Baldwin Wallace University, which is near Cleveland, Ohio. And after that, I had to do my internship, which was supposed to be 6 to 9 months, 1,200 hours. So mine lasted, I think, about 7 months, which was in New York City. It was with hospice patients, mostly at the Metropolitan Jewish Health System. So I was mostly working in Manhattan, working with people of many different cultures and using music in their languages. And they were all at their end of life, mostly at home. Sometimes I would go to a nursing home for my internship as well. And then after that, I had to study for the board certification exam, which is uh, administered by the Certification Board of Music Therapists. So after studying for that, I took the board certification exam and I was a board certified music therapist. So now I'm able to put MTBC after my name. um, but yeah, that's mostly the requirement. But people can choose to go to a 4-year bachelor's program for something science or psychology related as well, and then choose to go to a master's program with an equivalency degree in music therapy, where they can get the bachelor's level education and also take the master's level classes and do the internship. So it just takes a bit longer to get that master's degree, but that way you can do something else for bachelor's as well. So my philosophy for music therapy, I'll just read this. I desire to walk with the individuals and their self-determined goals rather than pushing any agenda on them. I follow a humanistic, person-centered approach in my work, which helps drive the therapeutic process. I want to serve my clients best based on their backgrounds, ethnicities, cultures, and identities. Um, so I've always been humanistic. In school, I was mostly given a behavioral education in undergrad, but especially working with hospice patients and just meeting them where they're at. Some days they might be up for more music than other days. Some days they might just want to talk. Some days they might just need relaxation. So it's really, I really like just meeting the clients where they're at and working with them that way and providing them validation. So I mainly work, as I said, with individuals with developmental disabilities. Um, so a music therapist's role can include presence and individuals' personal journey of growth and self-actualization. So for developmental disabilities, we mainly work with, we focus on goals that can be related to communication, academic, cognitive skills, motor, emotional, social skills. And then under those goals, we have very specific objectives that we create with the individual. So let's say if someone wants to work on increasing communication, so maybe we'll work on having them ask a certain number of WH questions, like why, when, what questions during the session, and having them answer those questions. So we might do like stick to a certain number, and if they're able to achieve that for 3 consecutive sessions, we'll call that goal, we'll call that objective achieved. And then we might move the criteria a little higher. So we take data in our sessions, we note down progress. With me, I work under the Medicaid waiver. The music therapy in Indiana is under Medicaid waiver. So I often have to write progress reports, quarterly progress reports for each client, and submit those every 3 months, and have a team meeting with the case manager, maybe their behavior specialist, their family members, whoever is involved in their team. And the state looks at the reports, the state looks at how they can keep funding music therapy through the Medicaid waiver. So that's how developmental disabilities mostly get people with developmental disabilities get services for music therapy in Indiana. This is our main treatment process. We first get referrals. They can be made. They can be self-referrals. They can be the individual making them themselves, or their parents or family members referring them to music therapy, doctors, case managers, behavior specialists, or any other therapists they work with outside of music therapy can refer them to it. And then we have our first session where we build rapport. For a few sessions, we do assessment where we take down any strengths, weaknesses the clients has, anything they want to work on, and just have them written down in a report, in an assessment report. And then referring to that, we create the goals and objectives for the clients, and keep observing them, and then create music therapy strategies that can work on those goals and objectives and create the treatment plan. So most of the time, like let's say if a client wants to work on emotional expression, a lot of times we'll do song discussions. So that can be a music therapy strategy that we can use, and it can be put into the treatment plan. We evaluate the treatment plan. Termination in my setting with developmental disabilities happens much later. It really is dependent on clients when they want to terminate because it's a very long term population. Sometimes, like in hospice settings, clients may, uh, you know, the termination would happen earlier, or in outpatient, inpatient clinics, the termination might happen earlier. So it just depends on the setting. Here are some mental health populations that music therapy can be used with. I personally have worked with individuals with anxiety, depression, with borderline personality disorder, OCD, and schizophrenia. So this is a chart called, it's based on the polyvagal theory. Polyvagal theory is, it refers to the biggest nerve in our body, which is the vagus nerve. Um, Actually, in this picture, you can see it runs down the middle of the spine, this vagus nerve. So, according to the polyvagal theory, there is the panic, fear, anxiety stage where you're experiencing fight or flight, or there might be shutdown, depression, numbness. That stage is freeze. And then a stage where you're calm, grounded, mindful, uh, open, that would be social engagement. So the idea is to bring the client to the social engagement stage, but also help them understand the different stages that they may be experiencing. A lot of times, the fight, flight, freeze can be experienced due to trauma. That can be through many different reasons. This can be used in music therapy by having the clients make their own polyvagal ladder. Like this one shows a ladder. Um, so having them make their own ladder and having them visualize their own fight or flight stage, having them visualize their own social engagement stage, their own freeze stage. And we can even come up with songs, their preferred songs, and make playlists for each of those stages. Just something that can help them understand what exactly they may be experiencing in each of those stages. And if any of those stages come up during our sessions, we can practice addressing them, referring to those playlists, referring to this ladder that they create, and eventually helping them get to a calmer state and having them also learn carryover skills for their everyday life to get themselves to the social engagement stage. So, in mental health settings, music therapy can be used to increase social interaction. A lot of times, there may be groups where clients can increase cohesion, provide support to each other. It can allow them to find ways to problem solve, um, kind of like that polyvagal ladder, discuss different musical themes that they might find in songs, in their preferred songs. So, some strategies we might use are like music composition, music assisted relaxation, song discussions, lyric analysis, guided imagery of music, and improvisation. So, composition could include clients creating their own entirely original songs, which could be creating their own music or creating their own lyrics or both. Or clients can also substitute their own lyrics to a song that's already pre existing. Song discussions often will look at the words of the song, we'll listen to the song, we'll talk about what they hear in the music, what feelings came up while they were listening, what they heard in the lyrics, any words that stuck out to them, what how they can relate to themselves, those words in the music, what they see that the singer is singing about. So any of those things can help them communicate and help them understand emotions and also increase self-expression. Improvisation, really, we can have referential or non-referential, where in referential improvisation I would give clients like, okay, play this note, or play this instrument, uh, play it like this, or imagine this while you're playing it. Those can be reference. Or non-referential improvisation could include just having them sit at a piano or have a guitar or anything, and any instrument they want to choose, and just play along with me, and we all just make music together and then talk about what we were improvising. So I think Dr. Lane is probably the best person to share about how music therapy works in hospitals. So let me just share a little bit of her video here.
As a music therapist, one of the first experiences I had in intensive care unit was with a 20-year-old redhead who was brought into our hospital brain dead. She was several months pregnant, and our hospital decided to maintain her body on life support until the child could be safely delivered. And the intensive care nurse asked me to see the baby. She knew that the mother would never be able to provide any stimulation or nurture. Now, I know that music therapy is an evidenced profession, but I tell you, at that time, I could not remember anything anyone taught me about working with someone who had no brain activity. So when I was walking into the intensive care unit.
Are you able to hear it okay? I just wanted to check. Okay.
I did not know what to expect. And when I pulled the curtain back, my legs were wobbling. I walked over to her bed, and I saw this little lump in the middle of her belly. And I just gently placed my hands right over that little lump. And I began to sing. He's got the whole world in his hands. He's got the tiny little baby in his hand. And that baby began to dance under my fingers. I felt little knees and elbows rolling. I felt stretching. So I walked a little bit closer, and I sang a little louder and a little faster. This old man, he played two, he played knick-knack, and that baby's movements increased and the heart rate went up. And I thought, life on the inside responding to music on the outside. Several weeks later, when Samantha was born, she was lifted from the womb, and she did not cry. She sang. Maybe an E flat. And when I would go to the neonatal intensive care unit, and I would see her very distressed, splayed fingers, thrust tongue, scrunch face, or her levels of oxygen would desaturate, I would simply go over to her bed and lean down and sing, and she would calm, much like picture of that little baby I saw on the internet and wanted you to see. That's what she looked like to me.
There's one more clip here. Not sure.
Not just a survivor, but a thriver. Music stimulates diverse places in the brain simultaneously, and some of that allows the brain, especially if it's pleasurable music, to release its own endorphins, enkephalin, serotonin, our body's natural opiates, which can have an express effect on our emotions and our mood. Now, down the hall is Mr. M. He, you will see, is a most dignified man, an upstanding deacon in his church, married almost 50 years. He has had a stroke, and he has expressive aphasia. He understands what you say, but because of the brain damage, he cannot speak words. Before this particular time that you will see, I had been with him for a half hour, and he had been trying his best to talk to me. That's all that would come. So finally, I just say, let's see if we can do a little singing, okay? Now, the literature says the music you like most is the music you're going to be most responsive to. So I chose a song that I knew with which he was familiar, and I'm going to use a technique called Therapeutic Singing. I'm going to sing some of it, keep a total beat on his hand, giving some kinesthetic input, but then I'm going to leave out some words with the hope that he will fill in. Watch his mouth.
Me.
This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine, let it shine. Yes, everywhere I go, I'm gonna let it shine, let it shine, let it shine.
So that was a little bit about Dr. DeFoyle Lane. She is retired now, I believe, but she was working at the Seidman Cancer Center in Cleveland, Ohio, and at the University Hospitals in Cleveland, Ohio. But now I believe she is retired from there. Here are some other settings that music therapy can be used in. Music therapy in the media. You might have heard a little bit about Arizona Congresswoman Gabby Giffords. She received music therapy treatment to learn to speak and communicate after she had been shot in the head. There's a movie called The Music Never Stopped, which I think portrays music therapy pretty well. And Oliver Sacks, some of you may have heard of him. He was a neuroscientist from NYU. He's written this book called Musicophilia, which talks about all kinds of connections between music and the brain, the effects of music and the brain. And I think I had recently heard there's a show actually called Fosters, and there's a music therapist in that show, Fosters. I don't know much about that show. I'd have to watch it myself. So today I was thinking, with a very stressful time that we've been having since the past more than a year now, I was thinking maybe we can take a break today and just do some relaxation together. So I have a script here handy, and I'm going to play some live music on the guitar and just guide everyone through relaxation. So I encourage you to find a comfortable spot. You can sit, you can even lie down if you feel like it. But yeah, just get yourself in a comfortable position, and you may choose to focus on an object if you feel, or you may choose to just close your eyes if that works best for you to relax. We're just going to start with a deep breath in and out. Just noticing the feeling of your lungs filling up with air as you take a deep breath in. And hold your breath for a few seconds. And just release the breath slowly. And just letting the tension leave your body. Let's take another deep breath in. And hold it. And again, slowly releasing the air. Even slower now, just taking another deep breath. Fill your lungs and hold the air. Slowly release the breath and imagine the feeling of tension leaving your body. Now, as you're taking those deep breaths, let's move your attention to your feet. Begin to tense your feet by curling your toes and the arch of your foot. Hold on to the tension and notice what it feels like. And release the tension in your foot. Notice the new feeling of relaxation. Let's begin now to focus on your lower leg. Tense the muscles in your calves. Hold them tightly, and pay attention to the feeling of that tension in your calves. And now release the tension from your lower legs. Again, notice the feeling of relaxation. And remember to continue taking deep breaths. Next, tense the muscles of your upper leg and pelvis. You can do this by tightly squeezing your thighs together. Make sure you feel tenseness without going to the point of strain. And release Feel the tension leave your muscles. Begin to tense your stomach and chest. You can do this by sucking your stomach in, squeeze harder and hold the tension just a little bit longer. And release the tension. Allowing your body to go limp. Let yourself notice the feeling of relaxation as you're breathing in relaxation and just breathing out all that tension. Continue taking deep breaths. Breathe in slowly, noticing the air fill your lungs, and hold it. And release the air slowly. Feel it leaving your lungs. Next, tense the muscles in your back by bringing your shoulders together behind you. Hold them tightly, tense them as hard as you can without straining, and keep holding. Release the tension from your back. Feel the tension slowly leaving your body and the new feeling of relaxation. Notice how different your body feels when you allow it to relax. Tense your arms all the way from your hands to your shoulders. Make a fist and squeeze all the way up your arm and hold it. And release the tension from your arms and shoulders. Notice the feeling of relaxation in your fingers, hands, arms, and shoulders. Notice how your arm feels limp and at ease. Move up to your neck and your head. Tense your face and your neck by distorting the muscles around your eyes and mouth. And release the tension. Again, notice the new feeling of relaxation. Just taking a couple more deep breaths. And releasing the tension. Breathing in relaxation. And breathing out the tension. Finally, tense your entire body. Tense your feet, your legs, stomach, chest, arms, head, and neck. Tense harder without straining. Hold the tension. Now release. Allow your body to go limp. Pay attention to the feeling of relaxation and how different it is from the feeling of tension. Just taking in a few more deep breaths, just breathing in relaxation and breathing out all the tension. If you notice any other areas of tension in your body, just breathing in relaxation and breathing out the tension. Begin to slowly wake your body up by slowly moving your muscles. Adjust your arms and legs. Stretch your muscles. Open your eyes when you're ready. And I hope you can remember this relaxation for the future. Just remind yourself to relax and take breaks and take deep breaths. So I will leave the floor for everyone for their questions now.
Okay, so yeah, I'm very relaxed now. We do have some questions in the chat. First question we have here is what's kind of the how's the work divided between clients with learning disabilities and clients who are undergoing rehabilitative treatments?
So like how many clients are getting music therapy that have learning disabilities and how many are getting for rehabilitated?
Right, I believe that's what they're asking, yes.
Okay. I don't think there's any like ratio, honestly. I think it's just there are lots of music therapists working with clients with learning disabilities and developmental disabilities. And there are lots of music therapists working in rehabilitative settings, whether in hospitals or mental health settings or anything. So it really just depends. There is a wide range of music therapists everywhere, wide range of settings everywhere. I would say here in Indiana, there are a lot of music therapists, I think maybe a lot more music therapists working with developmental disabilities, maybe just because music therapy is on the Medicaid waiver for that population. I think that's why. Although there is, like here in Indianapolis, there is the Riley Children's Hospital, if any of you've heard of it. They have music therapists there. So they provide music therapy to NICU and children. And I think there's a Seasons Hospice here that also provides music therapy in hospice settings.
So got time for one more here. I mean, humans have been making music for all of our history. How do you think music therapy relates to the role of music just in culture generally?
Yeah, I think it's important to take all the cultural contexts in consideration when working with any clients. I think it's important to consider where the clients are coming from, what their backgrounds are, and let's say if someone is from India and they have been, growing up listening to Indian classical music, I would take that into consideration while working with them and use that as their main music, preferred music for our sessions. Um, but yeah, I think historically um, there's evidence in a lot of cultures of how music has been effective, how it has been healing. Um, but I guess music therapy is more evidence based and like using all those historical contexts, but also using some of the data and everything we've found in our journals and books to help us navigate the profession and help us work with different clients. I hope that makes sense and answers the question.
Okay. So we got time for one more. So for someone wanting to go to college for music therapy, what kinds of experiences would you recommend that someone has to help them get accepted and be successful in a program like that?
Yeah, if it is someone going to an undergrad program, I would recommend, participating in all of the music ensembles, classes that they can in high school. That's what I did. I never really was part of a choir, but I did participate in the marching band. I participated in pit orchestra, jazz band. My primary instrument throughout was the saxophone, throughout high school, throughout college. Um, so basically, having some musical knowledge, some musical experiences, and there's an audition requirement when you're going for a bachelor's in music therapy. So I had to do auditions at most colleges and interviews, and that's how I got accepted in a music therapy program. For someone who is doing something science related or psychology related for undergrad and then applying for music therapy as a master's program, I would recommend the same thing. I would assume they have some musical knowledge, some musical interests, like even if music is their hobby. So still, it's important to know like at least singing or having some knowledge of piano or guitar or any instruments really they can. Because I think there would still be some sort of audition requirement for grad schools. Actually, one question I had gotten directly asking if I offer online sessions like this. So I actually don't have like my own practice. Since I'm working through Insights, I would have to get like my own liability insurance and everything to do that. I wish I could, maybe in the future. But right now, I'm not offering any online sessions unless you live in Indianapolis and you're trying to come through Insights Consulting for music therapy.
Thank you so much for joining us today. Really great, really enjoyable presentation. Please join us next week on Wednesday, February 24th at noon. We are going to have geologist Dr. Sarah Ahrens. She is assistant professor at Scripps Institution of Oceanography at UC San Diego, and she will be presenting titanium isotopes in the Acosta Gneiss and the origins of plate tectonics. So this is going to be a great one if you're interested in geology like I am. This is going to be a fantastic one. So you can register for next week's talk at smv.org. Each talk is free to attend and is open to the first 300 registrants. Thank you all again for joining us today. Until next week, stay safe and stay curious. Thank you all for coming.